Welcome. Today we'll be going over Chapter 38, EMS Operations. We will be covering preparing for the ambulance call, receiving and responding to a call, transferring the patient to the ambulance, and transporting the patient to the hospital. We will be discussing specifics about transferring the patient to the emergency department staff, terminating the call, and air rescue. There are several different types of ambulances. Here we have a type 1. Here is a type 2. Here we have a type 3 ambulance. So we've gone over type 1, 2, and 3, also called A, B, and C. We're getting into the type D now, a medium duty ambulance. Here we have a type E, or a specialty response vehicle. An ambulance without proper equipment may have its agency cited and fined a considerable amount of money by a state EMS regulatory agency. So we need to learn where each item is, what it is for, and when it should be used. We also need to do a thorough truck check. The state can come in and do inspections at any time without warning, and an agency can be fined if it is not stocked to the state level. So be sure that you, your vehicle, and your equipment are ready to respond when an emergency occurs. If the state does come to do a surprise inspection, they can ask anybody on shift for copies of their national registry and state licenses, BLS, CPR card, whatever the state requires. So we need to make sure that you, your vehicle, and your equipment are ready. You know where all that stuff is. So inspect the vehicle and equipment at the start of every shift. Do a shift report with the off-going crew. There's two components. There's the vehicle component and the equipment component. It's nice if the vehicle component's completed by the person who's going to be driving primarily, but a lot of times it's a team effort. It's not necessarily divided into different crew member responsibilities. It's done as a team. The ambulance needs to be checked everywhere, not just if it has fuel, but the ambulance body, wheels, tires, windshield wipers, all the fluids. Make sure that the ambulance is completely functional. Checking the interior surfaces, that's great. Between shifts, I like to clean my ambulance. Use a Sandy wipes or whatever cleaning agent that you have to make sure that the ambulance is clean and ready for the next patient. So with the engine off, inspect the body of the vehicle, report any damage that may be evident, indicate past damage that has not been repaired, inspect the tires and wheels, check for damage or worn rims, tire sidewalls, check the tread depth, use a pressure gauge, make sure that the tires are inflated to the proper pressure, inspect the windows and mirrors, look for any broken glass and loose or missing parts. Make sure your mirrors are clean and properly adjusted for you for maximum visibility. Check the operation of every door and all latches and locks. I think once you've been in EMS long enough, you will have driven the ambulance with a door open on accident. So we need to make sure whoever's responsible for driving the vehicle needs to make sure that everything is latched up, locked up, and good to go before we put that vehicle in motion. Check all the fluid levels. You check the battery, inspect the battery connection for tightness, any signs of corrosion. Inspect the interior surfaces and upholstery for damage and cleanliness. Like I said earlier, you can wipe down everything. Wipe down the wheel, the mic, all the back, the seats, that little bar on the top. Wipe down your monitor, all your bags, all that. Check the windows for operation and cleanliness. Test the horn, siren, and emergency lights. Adjust the driver's seat and ensure the belts are operational, and check the fuel level. So with the engine on, you can check the dash mounted indicators to see if there are any lights that indicate a possible problem with oil pressure, engine temperature, or the vehicle's electrical system. Um, Check to make sure that the gauges are operating properly. Depress the brake pedal, note the pedal travel, check air pressure if needed. Test the parking brake, move the transmission level to a drive position, replace the level to park position as soon as you are sure that the parking brake is holding. You turn the steering wheel from side to side, check the operation of windshield wipers and washers. The glass should be wiped clean each time the blades move. Turn on the vehicle's warning lights, have your partner walk around the ambulance and check each flashing and revolving light for operation. Turn on the other vehicle lights, have your partner walk around the ambulance again, this time checking the headlights, both high and low beams. Turn signals, four-way flashers, brake lights, reverse lights, side and rear illumination lights, and box marker lights. Check the operation of the heating and air conditioning equipment in both the driver's compartment and the patient compartment. Check the onboard suction. Operate the communications equipment. Test portable and mobile radios and any cellular telephone communicators. If your unit is equipped with a backup camera, make sure that the camera is not damaged and is clean. Return the ambulance to quarters. While you are backing up, have your partner note whether the backup alarm is operating. Inspection of patient compartment supplies and equipment. Using your checklist, conduct a detailed inspection and inventory of the equipment and supplies. I personally really enjoy doing this. I know that sounds weird, but it ensures that I know where all my stuff is, which is why I do it with my partner. We don't really divvy up responsibilities like that because my partner and I both need to know where everything is, and we have a lot of equipment, so it can be easy to forget where everything's at, especially if you're an EMT working on an ALS ambulance. Being part of that partnership and that responsibility helps you retain where all that stuff is at. Check treatment supplies, interior equipment, and exterior equipment. Check the pressure of oxygen cylinders. You test the oxygen and ventilation equipment for proper operation. Examine any rescue tools. Operate any battery-powered devices to ensure that the batteries have a proper charge. Some equipment, such as the AED, may require additional testing. See that an item-by-item inspection of everything carried on the ambulance is done, with findings recorded on the inspection report. Complete the inspection report, correct any deficiencies, replace any missing items, make your supervisor aware of any deficiencies that cannot be immediately corrected. Finally, clean the unit for infection control and appearance. Use only approved cleaning and disinfecting materials. So as I walk around the vehicle with both the engine on and engine off check, what information do I get from what I hear, see, and smell? So if we smell something like burning belt, engine coolant, engine oil, if we hear a noise that sounds abnormal, if we see a tire that looks lower than the others, those are all things we can get from a walk around of the vehicle. And like I said earlier, doing a walk around of the vehicle before you get into the ambulance to drive off from a scene, if we grab the stair chair and put it up but forgot to close the door, if you don't do a walk around, that door could be left open and you may not notice it. Your ambulance may not be equipped with like a door open indicator. So the role of the emergency medical dispatcher. So EMD training is not a state requirement right now. So this is not going to be done everywhere, but it's good information to go over. So the role of them is to ask questions of the caller and assign a priority to the call, provide pre-arrival medical instructions to callers and information to crews, dispatch and coordinate EMS resources, and coordinate with other public safety agencies. So some of the questions EMD should ask, what is the exact location of the patient, a callback phone number, what's the problem, How old and what is the gender of the patient? Is the patient conscious and are they breathing? Operating the ambulance. Being a safe ambulance operator. You should be physically and mentally fit, be able to perform under stress, have a positive attitude about your ability as a driver, but not be an unreasonable risk taker. When we drive around with lights and sirens, people tend to act very irrational in front of us. It's nice to think that they'll all slow down and pull to the right. That's not the case. That being said, be tolerant of other drivers. We are asking for the right of way. We're not demanding it. Don't be driving an ambulance as a road rager. Never drive while under the influence of any substance. Never drive while taking prescription medications that may impair your ability to operate a motor vehicle. Never drive with a suspended license. Always wear your glasses or contacts if they're required for driving. Evaluate your ability to drive based on personal stress, illness, and fatigue. This isn't something that's stressed a lot on the ground. Our agency does a pretty good job of assisting in this case. If you have something going on in your personal life, if you're come to work and you're too ill or too fatigued, and it is a safety concern that you're driving, there are workarounds. You should evaluate your own ability and notify a supervisor in that case. Understanding the law. An ambulance operator must have a valid driver's license and may be required to complete a training program. Privileges granted under the law to the operators of ambulances apply when the vehicle is responding to an emergency. This is not applicable if you're not on a call. But we can't just turn the lights and sirens on to get through an intersection just because we want to. It has to be responding to an emergency. Even though certain privileges are granted during an emergency, the exemptions granted do not provide immunity to the driver. So your agency will have policies and guidelines, procedures outlining what you can and cannot do while driving emergency with lights and sirens. If you go against your agency's protocol and get in an accident, you can be held personally liable. So privileges granted during emergency situations apply only if the operator uses warning devices in the manner prescribed by law. So for an ambulance, part of that law is that if we are driving with our lights on, we have to have the siren on. It is not a one or the other for an ambulance in the state of Oklahoma. If your lights are on, your siren must be on as well. Most statutes allow parking wherever necessary as long as life and property are not endangered. Proceeding past stop signs and signals. That being said, if it is a stop sign, if it is a red light, we come to a complete stop and clear one lane at a time. So we move through the intersection very slowly. We can proceed past that, but that is not a disregard the red light. We have to ensure that the other drivers in the intersection see us and that we're passing through that intersection safely. Another thing that it allows is exceeding the posted speed limit as long as life and property are not endangered. Most policies, it's 10 to 15 miles an hour over the posted speed limit. And there's normally a max speed limit that's normally about 75 miles an hour. Passing other vehicles in no passing zones after properly signaling and taking precautions. And disregarding regulations that govern direction of travel and turning with proper use of caution and signals. So we don't necessarily have to use our turn signals. I still highly suggest it. Like I said, people can be unpredictable when your lights and sirens are on. They may not even notice your turn signal, but that's just one more thing that you could do to hopefully indicate to somebody else which direction you plan to travel. And then opposing traffic, says disregarding regulations. That means we can oppose traffic, but again, you should have a policy for a maximum speed limit. So when you're opposing traffic, Most policies that I've seen require you to go like 10 miles an hour or less while you're opposing traffic. Using the warning devices, so the siren, never use it indiscriminately. The horn and visual warning devices, those should be on day or night. And the vehicle should be easily seen from 360 degrees in emergency response mode. So your lights, like I said, in your inspection of the vehicle when you get on shift, you need to ensure that all the lights on all sides of the vehicle are functioning. Excessive speed increases the probability of a collision. Speed increases stopping distance as well. So that reduces the chance of avoiding a hazardous situation. Being a vigilant driver is very, very important as an EMT. Even if the light is green, I like to slow down before I get to the intersection so that if it does turn red and no one sees me and the other lights turn green, they're not going without me having an opportunity to come to a stop and clear the intersection properly. Escorted or multiple vehicle responses. Inexperienced ambulance operators often follow the escort vehicle too closely. That could cause you to be unable to stop if the lead vehicle brakes too hard. Recommendation of no escorts unless absolutely necessary. We don't normally get escorts, but when we do, you have to use greater care. Some factors that affect response, the day of the week, time of day, the weather, road maintenance and construction, railroads, bridges and tunnels, schools and school buses. Navigating to the scene. A global positioning satellite or GPS navigation is often installed, but there is no substitute for an intimate knowledge of your response area. The GPS can kind of become a distraction that causes you to take your eyes off the road and look at your phone or look at a GPS. Having a good knowledge of what's in your area is paramount. Obtain detailed maps of your service area if you're able to. A response safety summary. Minimize lights and siren hot responses. Driving with lights and siren involves high risk. The majority of ambulance accidents are done while driving hot. Wear your seatbelts and know where you're going before you respond. Use the GPS and check the maps. Be familiar with your response area. Safety at highway incidents. Keep unnecessary units and people off the highway. Avoid crossovers unless a turn can be completed without obstructing traffic. Protect the scene if it's yours. If you're the first on scene, you need to park in a manner that protects the scene. If you're responding after the fire department's there and they've already blocked the scene, then we can move in front of the accident. Wear your PPE. Having that safety vest on, a high visibility vest, whether it's daytime or nighttime, is very important. I don't have the numbers right now, but it's a pretty staggering number of first responders that get struck by vehicles every year, even in the state of Oklahoma. You can place cones or flares and reduce emergency lighting. Your unit placement is very important. I like to park in front of the scene. My vehicle is the most protected there if law enforcement and the fire department are already protecting the scene. Avoid backing up if possible, especially during emergencies. So when we park at an emergency scene, even if it's not on a traffic accident, when we park our vehicle, we already need to be thinking about how we're going to get out of that scene. Transferring the patient to the ambulance, we need to select proper patient carrying device, package the patient for transport, move the patient to the ambulance, and load the patient into the ambulance. So the 4 steps of transferring: this patient is packaged for cold, wet conditions. So You can see that patient is pretty bundled up. So, packaging the patient, readying the patient to be moved, and combining patient and patient carrying device as a unit ready for transfer. Sick or injured patients must be packaged so that the condition is not aggravated. They also need to be packaged in a way that if you need to do any further interventions, we have access to whatever we need to get to. Before placing the patient on a carrying device, we need to complete any necessary care for wounds and other injuries, stabilize any impaled objects, and then check dressings and splints. Cover the patient and secure them to the patient carrying device. So the patient must be secured to that device, a minimum of 3 straps to secure, one at chest level, one at waist level, and one at the lower extremities. If there is a shoulder harness, it should be used. The EMT is at a great risk in the patient compartment, so we need to remain seated and wear our seat belts and a harness if possible. Avoid unnecessary movement during response and transport, and make sure all of your equipment is secured. Preparing the patient for transport. So we're going to continue our assessment throughout patient care. Secure the stretcher in place in the ambulance. Position and secure the patient, adjust security straps, and prepare for any potential complications. Loosen any constricting clothing. Load the relative or friend who must accompany the patient if they are present. Make sure that that person is also seatbelted in. Load any personal effects. Pro tip, I like, as long as it's not a heavy object that's going to cause issues if we got into an accident, I like to set it down by the feet of the patient. Otherwise, I will forget it in the ambulance and have to come back and get it. Talk to your patient. There's no reason you should be sitting behind the patient the entire time doing paperwork and not treating the patient like a human being. So I like to sit next to the patient on the bench seat if possible. I can still do my paperwork there. I can still be seat belted in. I can still see the monitor. But talk to your patient. So caring for the patient en route, we need to notify the hospital. Give them ample time. We want to try to give them at least 10 or 15 minutes of notice. Continue to provide emergency care as required. Use safe practices during transport. Compile any additional patient information. Continue assessment and monitor vital signs, and notify the receiving facility. A pediatric note: the entire scene may create a terrifying experience for a child. A toy such as a teddy bear can do a lot to calm them down. The presence of a female EMT or police officers may be helpful too. Small children do not, as a rule, carry any identification, so try to get that information from an adult caregiver. Transferring the patient to the emergency department staff. In a routine admission situation or when an illness or injury is not life-threatening, check first to see what is to be done with the patient. Assist emergency department staff as required and provide a verbal report. As soon as you are free from patient care activities, prepare the pre-hospital care report. Currently, most PCR, like digital PCR programs, once your PCR is completed and submitted, it goes to a cloud of some kind and gets sent to the hospital once your PCR is completed. We don't really do like the patient drop-off reports where it has to be done prior to leaving the hospital. Transfer the patient's personal effects. Make sure you don't leave anything on the ambulance that belongs to them, and obtain your release from the hospital. So make sure that they are good to go and they don't need any further information from you. Terminating the call. At the hospital, clean the patient compartment while taking appropriate standard precautions. Prepare any equipment that you use for service. Replace expendable items. That a lot of times is done when you get back to the station and not at the hospital. Exchange equipment according to your local policy. If we bring a backboard to the hospital that doesn't get removed from the patient, a lot of times there's a room full of backboards. You may have to clean it, but make sure that your ambulance is restocked. And then make up the ambulance cot. So you radio the dispatcher, let them know that you are clear of the call, refuel the ambulance when you get back to your fuel point. Once you're in quarters, you can place any contaminated linens in a biohazard container if you haven't done that at the hospital. As necessary, clean any equipment if you haven't already done that. Clean and disinfect anything like non-disposable respiratory, so the face of the monitor, all the buttons on the monitor, if you did not do that at the hospital, and prepare yourself for service. Once you're in quarters, you can replace those expendable items, replace or refill any oxygen cylinders, any patient care equipment, carry out any post-operation vehicle maintenance procedure, clean the vehicle if you need to, and complete your paperwork. So when to call for air rescue. So there are operational reasons. So to speed transport to a distant trauma center, when extrication of a high priority patient is prolonged, and air rescue can speed the transport, and when the patient must be rescued from a remote location. So if we already know the nature of the call and we know that we're going to be much further, or it's going to take a lot longer for us to get to a trauma center by ground, we can launch a helicopter to meet us on scene. Same with the extrication of a high priority patient that's prolonged. That aircraft can show up to the scene and wait until the patient is extricated and transport the patient by air. And if they're already on scene, it's going to take them a fraction of the time to get to the trauma center. So some clinical reasons: if you have a patient in shock, a patient with a GCS total less than 10, head injury with altered mental status, chest trauma and respiratory distress, penetrating injuries to the body cavity, amputation proximal to the hand or foot, extensive burns, a serious mechanism of injury, or the patient is post-cardiac arrest with a pulse. You can't do CPR in an aircraft, so a lot of times if you call the helicopter for a post-cardiac arrest, if the patient is really stable and they feel good about it, they'll transport them by air. Sometimes the crew will just jump on your ambulance and assume patient care while you transport them to the hospital, and the pilot will fly the aircraft to the hospital you're going to pick up the crew. So how to request air ambulance? Normally this is done through dispatch. You can request the agency by name. Your dispatch may have a list of services to use. They will need the nature of the situation, the exact location. So crossroads, major landmarks, coordinates if you have them. A location and description of the landing zone. Most fire departments are pretty well versed in establishing an LZ, but we will be going over that in class. Describe the landing zone to the air ambulance service. So the terrain, any major landmarks, things like power lines, tall trees, ditches, uneven terrain, that stuff. The area should be a fairly flat, free of lines on the majority of sides. If there's lines on one side or another, that's okay. They're not going to land somewhere where it's just a whole lot of power lines. It needs to be about 100 feet by 100 feet. There we go. So the approach area, the medical crew is going to get out of the helicopter and make its way to you. You don't need to rush into the helicopter when it lands. Even the medical crew takes all the commands from the pilot. They clear it with the pilot that it's okay to move in underneath the rotors. So we want to make sure that we're taking commands from the medical crew and from the pilot. So do not approach unless you're escorted. Allow the crew to direct loading of the patient. Absolutely 100% stay clear of the tail rotor at all times. You never need to go behind the doors. Keep all traffic and vehicles at least 100 feet away from the helicopter. Do not smoke near the aircraft and be aware of the danger areas, which on a helicopter is everywhere. Just follow the direction of the flight crew. Chapter review. Inspect the vehicle to ensure it is complete and critical items can be easily located. A hot response means using lights and siren. Now, hot responses involve high risk. A cold response means no lights or sirens, and that decreases the risk. The laws in most states allow the driver of an emergency vehicle running hot to break some of the vehicle and traffic laws. However, it must be done with due regard for the safety of others. Pay attention. Do not text, make phone calls, drink beverages, or in any way be distracted while you're driving. Secure all gear. It can become a projectile in a crash. A lot of the gear that we carry is pretty heavy. We don't want that flying around if we do get in an accident. Don't let your patient become a projectile. Use the stretcher shoulder straps. Use all the straps that you have available to you on the stretcher. Wear your seatbelt when you're in the front and in the back, whenever possible. Obviously, there are times we're going to be performing patient care and we're going to have to get up from a seated position to do that. But when you're done doing what you need to do for the patient, we need to sit back down and buckle back up. Know the medical and operational reasons for helicopter transport and know how to set up a safe helicopter landing zone. One thing I forgot to mention earlier was if you have the personnel available to do a sweep of the landing zone and make sure that there's no trash. Those rotors kick up a lot of dust, any trash. You know, if it's a small paper cup or whatever, that's not a huge deal. But something like a trash bag, even if a trash bag comes up and gets caught in a rotor, that helicopter is going to be out of service and you're not going to be able to utilize them. So we need to take the time while we're waiting for the helicopter and delegate somebody to clear that landing zone of any trash. Ambulances must be properly stocked and prepared. Pre-call inspections assure readiness and appropriate equipment. Emergency medical dispatchers enhance patient care by providing pre-arrival instructions and by obtaining information for responders. Again, this does not always happen. It depends on if your dispatchers are trained EMD dispatchers. Each state has statutes regulating operation of emergency vehicles. As an EMT, you must be familiar with local rules and regulations. EMTs should use good judgment and due regard for safety of others when operating an ambulance. The 4 steps involved in transferring the patient to the ambulance are selecting proper patient carrying device, packaging the patient for transfer, moving the patient to the ambulance, and loading the patient into the ambulance. Patients should be secured prior to the ambulance moving. Assessment and care must continue during transport. The primary concern of transfer of care is continuation of patient care. Failure to do so properly can be considered abandonment. That's like if we were to bring the patient to the hospital and put them in a room in the emergency department and then leave without giving the hospital staff a patient report. So just make sure that you're giving a good patient report, make sure that the hospital doesn't need any more information from you, and then you can move on. Cleaning the ambulance, replacing used supplies and equipment, and readying the ambulance stretcher are important elements of the EMT. However, EMT should be prepared for unusual circumstances. Indications for utilizing air rescue may include both operational and medical reasons. EMTs should be familiar with local protocols for assessing and utilizing air ambulance. Some questions to consider. Does the patient have a true emergency adversely affected by time? So, one question that I like to ask myself is, if I were to do nothing for the next 5 minutes, where am I expecting this to go? That's a good scene size up. Coming from a fire background, if I arrive on scene of a structure fire, I ask myself the same questions, and that helps me prioritize my actions. How can I park to best protect the scene and personnel? So if we are first on scene, we have to protect the scene. We're going to be out there working, so we need to know where to best park to do that. If we are not the first on scene, we need to be worried about egress. So when I have to depart the scene, what's going to be the easiest way for me to get out of here, the easiest and safest? Does my personal protective equipment match what is being worn by others? Don't base that off of what other people are doing, because that may be wrong, and you're not wrong to call them out. So if you show up on a motor vehicle accident on a road, then you need to be wearing your safety vest. If somebody else is not wearing that, you need to make sure that they can get one. We need to make sure that everybody on scene is safe. So critical thinking. What equipment should you include in a kit that you can carry to the scene? Personally, where I work, our protocol is that we take all equipment to patient side. That's the airway bag and the trauma bag. It's got almost all the equipment that you have on the ambulance within those two bags. If you have that stuff at patient side, you should have everything that you need. How should the equipment be positioned so that you can reach urgently needed items quickly? Again, if those are at patient side, in a safe location or an accessible location, should not be a problem. What special items, if any, should be in the kit to meet local needs? If you are on a tactical team or something like that, our trauma bags have 2 tourniquets in them. That is not enough. If you're going out for some kind of special mission, something out of the normal realm of ground EMS, you may need to look into that. But again, if we have our bags at patient side and accessible, we should not have to have any special items. All right, that's it. Thank you for your time.